March in 1998, Kathy came to Community Clinic, and it was a volunteer clinic, and she played many, many roles in the early days. She wrote grants, checked in patients, made patient appointments. She's been involved from day one.
She has developed the poise and the understanding of how to deal with people.
She's always thinking ahead. She's always thinking outside of the box. We swear she never sleeps, or she sleeps in her office. We can't figure out how she has the energy and the drive every day to do what she has done in the community. Kathy's married to Lowell Grisham, and they have 2 children, Gray and Allison. They have 3 grandchildren, 2 grandsons and a granddaughter, and she's as proud as punch to talk about them. She's very involved in the lives of her grandchildren.
You love the way she listens. And that's what has allowed her to forge the partnerships in the healthcare community that normally are not accomplished. She also is able to give everyone that sense of understanding what the goal will be and how relevant they are to being a part of that. She can pull together coalitions of individuals you would never think would even be in the same room, simply because she knows, because she's done her homework, what everyone is interested in trying to accomplish. She does that really, really well.
When I think of Kathy Grisham, there's a quote that comes to mind. If you have a dream, don't just sit there. Gather courage to believe that you can succeed, and leave no stone unturned to make it a reality.
Thank you so much. I'm deeply moved by this recognition from the Foundation, but there are so many other people who have also been a part of this. We have a team, and we have been working a long time to implement the next evolution of healthcare for Northwest Arkansas. God bless Joel Carver, who would not sit still when he saw so many neighbors who were uninsured. He had the vision to form a clinic for them. To Joyce Brown, who started this little faith-based volunteer clinic, and to Bernice Jones, who invited us into a marvelous space when we were about to close our doors. We've had great leadership from board chairmen like Nan Smith-Blair, Joyce Heismeyer, Debbie Nye, and our ever-evolving and adapting professional staff. Federal dollars, our tax dollars, leverage our clinic's ability to reach more people. Our little clinic went from serving 5,000 patients to nearly 30,000 people annually who would otherwise burden emergency rooms or go without health care until they became critically ill. That investment made all the difference between a little volunteer operation and a truly professional healthcare network. I am grateful, and so are the families we serve. Thank you for honoring our work.
I'm Dr. Larry Armstrong. I'm the Chief of Neurosurgery at Washington Regional Medical Center and work for the Northwest Arkansas Neuroscience Institute, which is this year's beneficiary of the Washington Regional Foundation. And we want to express our sincere gratitude to not only the community, but to the foundation and to each person who's in attendance tonight for your sponsorship of the Northwest Arkansas Neuroscience Institute initiative, which will be the Neuroendovascular Suite. There are 2 neurosurgeons joining us from Vanderbilt University in August of 2014. Dr. Mayshan Giassi is the older of 2 brothers. Dr. Mohan Giassi is the younger of the 2 brothers, and they are both interventionally trained neurosurgeons. So they offer a unique perspective of young men who have had to work very hard for everything they have achieved in life. Their family understands the value of the American dream in needing to work hard so that you can achieve great goals in life, and what they're going to offer to our community, and this hospital in particular, and everyone who surrounds this region will be very unique in that they'll save many, many lives and they will improve the quality of life of Northwest Arkansans in ways we can't even imagine. This is a service that is performed in fewer than 50 centers across the country, and it's going to be here in Northwest Arkansas, an important addition to our community. It'll be one of the few centers within a 5-state radius that can offer this type of service. What it means to the community to be able to offer them this type of intervention, it is a significant financial outlay to be able to build this type of suite. But what it offers is the same thing you'd be able to get if you lived in the city of Houston or Chicago or Boston, and it's going to be right here in Northwest Arkansas. It's going to enable the community to receive top-class medical care in a facility that's within a small community. What the neurointerventional vascular team offers is it offers a specialized team, not only of specialized anesthesiology in interventional neuroanesthesia. It requires specialty trained nurses, it requires specialty trained scrub techs, it requires specialty trained operating room personnel. So what this is going to mean to the community is not only improved survivability, but improved quality of life, improved outcome from a stroke or a hemorrhage or a tumor, an improvement in the community health, in that we're now able to offer them things that could only be done in a large university medical center.
I'm Dr. Mohan Gayasi.
And I'm Dr. Meshan Gayasi.
We want to thank the Washington Regional Foundation for making the neurovascular hybrid room the beneficiary of this year's gala.
We hope you guys all have a great night, and we look forward to joining you in August.
Faith in Action is an organization which really helps the most vulnerable in our community, the elderly. And it's people that have limited mobility, limited resources, and probably limited support. And they're providing them with people to help them go to the grocery store, to get medicine, to help them prepare a meal, and just a number of things that these people are helping them do. And it's a great illustration of collaboration in a community. We heard about Faith in Action through one of our employees, and they had helped one of their family members, and so that was the initial opportunity for us to find out who they were and what they were doing. And from the very start, we loved the mission that they had and the work that they were doing at Faith in Action and through Savor the Flavor.
So Savor the Flavor is a walking tasting tour of Dixon Street. You get out and be able to taste all the food on Dixon Street. We think that is a lot of fun. It's a lot of food, and it's an enjoyable night for your whole family. In 2013, we were able to net 98% of all the funds coming in. It goes right straight back into Faith in Action. So you can eat tonight while our seniors can eat for free for a whole year.
And for the last 5 years, we've continued to be the presenting sponsor. And it's really because we believe in their mission. They're giving the elderly an opportunity to be independent and self-reliant. We also love the fact that they are collaborating with the community. And that's a lot like Hearts, because we're an employee-owned company and we're dependent on each other for our success. And we're all based on teamwork. So it's an organization that we can give to that all our employees can be proud of and support. And we love the work that they're doing, and thank you so much, Faith in Action.
What I love about Faith in Action is we're able to provide services to our seniors. We're able to take them to and from doctor's appointments. We're able to sit with them and read. We're able to go out and do some chores at their homes. We think that's really fun just because we're getting out there in the community and helping them with things that they cannot get out and do. So those are a few of the things that we're able to do with helping the seniors out.
Hi, it's my distinct pleasure and honor today to be able to accept this award on behalf of Faith in Action. Of course, I need to give credit to our advisory board and to our staff. We have a wonderful staff here at Faith in Action, and we have had for our 17 years of operation. But all the credit for this award, of course, goes to our wonderful, great volunteers. I'm humbled by the work that they do each day to take time out of their lives to make a difference in homebound seniors' lives, and the things that they do for them. And again, thank you to Washington Regional Foundation for this Eagle Award.